Today in this video we are going to learn about the biphasic liquid dosage forms, that is suspensions. So suspensions are the biphasic liquid dosage form of medicaments in which finely divided solid particles which ranging from 0.5 to 5 microns are dispersed in liquid or a semi-solid vehicle. So that is the definition of the suspensions here. So the name itself indicates biphasic means it has mainly two phases. So the first phase is the solid phase here and the other one is the liquid phase. So the solid particles acts as a dispersed phase, whereas liquid particles acts as a continuous phase. So the suspensions are generally taken orally or by parenteral routes here. So they are also used for external applications also in some conditions. The particle size of the dispersed phase is very important in the formulation of the suspensions here. The suspensions which are made for the external application should have a small particle size to avoid the gritty feeling to the skin and also to cover a greater area of the application. Moreover, it also helps for penetration of the solid particles into the skin because its smaller particle size gives a faster rate of dissolution here. Okay, and the suspensions which are made for the parenteral applications should have particle size that can pass through the needle. So that is the specification here. And the suspensions which are instilled into the eye should be free from gritty particles to avoid some irritation, pain and discomfort to the eye. Okay, like that we have to maintain the particle size here. The particle size of the suspended particles should not go beyond 10 microns. Okay, according to the IP specifications, we have to maintain the particle size of the suspensions here. Okay, this is all about the introduction to the suspensions. So let us see some good qualities of a suspension. It should settle slowly and should be readily redispersed on gentle shaking of the container. So that is the main quality of the suspension. And the suspension should pour readily and evenly from its container. Okay, and it should be chemically inert. The particles should not form a cake. It should be free from large particles which spoil its appearance, gives a gritty taste to the oral preparation and also causes irritation to the sensitive tissues when applied externally. So these are all the qualities of a good suspension. So classification of the suspensions. Suspensions are classified into four main classes according to the pharmaceutical use. What they are means: oral suspensions, parenteral suspensions, ophthalmic suspensions, suspensions for external use. Let us see one by one clearly. First start with the oral suspensions. These suspensions are to be consumed by the patient by oral route only. Oral suspensions generally contains a flavoring agents and sweetening agents to mask the bitter taste of the drug here. They are also made palatable by using a suitable derivatives of the drug. Example, chloramphenicol palmitate suspension is prepared to mask the bitter taste of the chloramphenicol here. Nowadays, suspensions are available in the market in the dry form, especially in the powder form. And these are reconstituted by adding a suitable quality of a freshly boiled and a cold water before use. Example, antibiotics in a suspension for pediatric use. Okay, so let us see the advantages of the oral suspensions here. It is easy to swallow the suspended insoluble medicaments. The insoluble derivatives in the suspension is more palatable than the soluble derivatives in the solution. The bulky insoluble powders such as kaolin and chalk can be administered in suspension in order to act as a adsorbents of the toxins or to reduce the excess acidity in the gastrointestinal tract, especially in case of poisoning. Okay, so let us see some disadvantages of these suspensions. So all suspensions are required to be shaken before measuring a dose. The accuracy of the dose is less reliable as compared to the solutions. The storage of the suspensions may lead to changes in the dispersed phase, especially when there is a fluctuations in temperature. Okay, So all these are all the various advantages and disadvantages of the oral suspensions. And the next one is the parenteral suspensions. The suspensions which are administered by parenteral route are called parenteral suspensions. These suspensions are required to fulfill the various qualities like the particle size of the drug should be such that it can be easily passed through the needle of the syringe. There should not be any crystal growth in the suspension during its storage. The concentration of the solid particles in the suspension should be between 0.5 to 30%. The viscosity of the suspension should not interfere with its flow through the syringe needle. The suspension should be sterilized one. Okay. And next is the ophthalmic suspensions. So these are all not commonly used compared to eye drops. So these are prepared only in those cases when the drug is insoluble in the desired solvent or unstable in the liquid form. These suspensions must fulfill various conditions like the particle size of the eye suspension should be fine enough so that it should not irritating the eye. The suspension should be sterilized. This suspension should be isotonic. They should have some desired viscosity. The suspension should be packed in a suitable container so that it can be easily instilled into the eye. And next one is the suspensions for external use. These suspensions are made for external use, example lotions, inhalations, ear drops, etc. So these suspensions contains a very small particles to avoid the grittiness. So lotions containing suspended particles evaporates when applied to the skin, leaving a light deposit of the medicament on the surface here. Lotions are easy to apply and less messy than many other semi-solid external preparations. Calamine lotion is a suspension type preparation which is applied on the skin to provide the protective effect. Lotions which are made for external application on broken or inflamed skin should be free from harmful microorganisms. Okay. So this is all about the various type of the suspensions according to the pharmaceutical use. So another category of the classification of the suspensions includes flocculated and non-flocculated suspensions. So the suspensions are said to be flocculated when the individual particles are in contact with each other and form a network-like structure. Whereas in case of non-flocculated suspensions, the individual particles exist as a separate entity here. So the following are the differences between the flocculated and the non-flocculated suspensions. In this table we observe clearly here comparison between the flocculated and non-flocculated suspensions. In case of flocculated suspensions, the particles forms a loose aggregates and forms a network-like structure. Whereas in case of non-flocculated suspensions, the particles exist as separate entities. The rate of sedimentation is high in flocculated suspensions and the rate of sedimentation is low in non-flocculated suspensions. The sediment is rapidly formed here and the sediment is slowly formed here. The sediment is easy to redispersed in case of flocculated one. The sediment is difficult to redisperse in case of non-flocculated one. The sediment is loosely packed and does not form a hard cake here. And the sediment is very closely packed and form a hard cake in case of non-flocculated one. The supernatant liquid is clear here. Whereas in case of non-flocculated one, the supernatant liquid is not clear. The flocule sticks to the sides of the bottle. This condition is seen in flocculated one, whereas in case of non-flocculated one, the flocules do not stick to the sides of the bottle. Okay. And the suspension is not pleasing in appearance. Here the suspension is pleasing in appearance. Okay. So all these are all the main differences of the flocculated and non-flocculated suspension. And next one is the formulation of the suspensions. Various additives are used in the preparation of the suspensions, which includes fluctuating agents, thickening agents, wetting agents, preservatives, and organoleptic additives. We will see one by one clearly. First start with fluctuating agents. In suspensions, the solid particles are well dispersed in a dispersed media, that is vehicle here. The dispersion can be improved by adding a surfactants or a protective colloids which act as a fluctuating agent here. The fluctuating agents acts by reducing the surface tension and thereby improving the dispersion of the solid and minimizes the fluctuation here. Example, sodium lauryl sulfate, twins, spans and carboxyls are commonly used as a fluctuating agents. Okay. And next one is the thickening agents. So these are the hydrophilic colloids which forms a colloidal dispersion with water and increases the viscosity of the continuous phase so that the solid particles remain suspended in it for a sufficient long time to measure a uniform accurate dose here. Okay. The thickening agents used to stabilize the suspensions are classified into three major groups, mainly polysaccharides, inorganic agents and synthetic compounds. First we will see about the polysaccharides. Two types of polysaccharides are used nowadays. What those are means natural polysaccharides, semi-synthetic polysaccharides. Okay. So what are the natural polysaccharides means? Under this we have so many examples like gum acacia, tragacanth, starch, sodium alginate. Gum acacia. So it is a good preservative colloid and suspending agent. It is used in the mixtures containing a resinous tinctures. It is more effective when it is used as a compound tragacanth powder. Compound tragacanth powder contains acacia 20% and tragacanth 15%, starch 20% and sucrose. Compound tragacanth powder is used in the concentration of 2 grams per 100 ml of mixture. Okay. The compound tragacanth powder is always used when the vehicle is other than water or chloroform. Okay. And the acacia contains an enzyme oxidase, so which causes a deterioration of the easily oxidizable medicaments here. So benzoic acid and para-hydroxybenzoic acid are added as a antimicrobial agents to preserve the suspensions containing an gum acacia. Okay. And next one is the tragacanth. It is a better thickening agent than the acacia here. So it is used as a compound tragacanth powder or a tragacanth mucilage to suspend the heavily indiffusible substances. Here the tragacanth mucilage is used when the vehicle is water or a chloroform in the concentration of 1/4 of the volume of the mixture. Okay. And next one is the starch. The starch is sometimes used with other suspending agents because of the high viscosity of its mucilage here. It is an ingredient of a compound tragacanth powder. Okay. And next one is the sodium alginate. It forms a viscous solution when dissolved in a water. Its 1% solution have the same suspending power as that of the tragacanth mucilage here. Okay. And next one is the semi-synthetic derivatives. So the following cellulose derivatives are used as the thickening agents here: methyl cellulose, sodium carboxymethyl cellulose, microcrystalline cellulose. So all these cellulose derivatives are used as a thickening agents here. So first one is the methyl cellulose. It is generally used in the concentration of 0.5 to 2% as a thickening agent both in the external and the internal preparations here. And next one is the sodium carboxymethyl cellulose, that is SCMC. It is used in the concentration from 0.25 to 1% for suspending powders in the preparation made for oral, external and parenteral use. Okay. Microcrystalline cellulose. It is prepared from wood cellulose by acid hydrolysis method. It is dispersed in water to produce a colloidal dispersion here. Okay. So all these are all the semi-synthetic derivatives. And next one is the inorganic agents. First one is the clay. So bentonite and aluminum magnesium silicate is very commonly used as a thickening agent. So bentonite is a very pale buff or creamy hygroscopic powder here. A 2% suspension is used for the suspending indiffusible solids in the external preparation such as calamine lotions. Okay, so aluminum magnesium silicate is a creamy white colorless and a tasteless powder here. So it is used as a thickening agent both in the external and the internal preparations. Okay, and next one is the aluminum hydroxide. So it is used as a suspending agent in suspensions containing barium sulfate, calamine, sulfonamides and sulfurs. Okay, some synthetic compounds includes carbomers and colloidal silicon dioxides. Okay, so these are also used as a thickening agents here. So carbomers means carboxyvinyl polymers. It is used as a thickening agent in the concentration of 0.1 to 0.4% for internal and external preparations. And colloidal silicon dioxide, it is a white non-gritty powder and act as a suspending agent in the concentration of 1.5 to 4%. So for every preparation we need to remember the concentration percentages, everything here. And next one is the wetting agents. So these are the substances which reduces the interfacial tension between the solid particles and the liquid media, thus producing a suspension of a required quality here. This may be achieved by adding in a suitable wetting agent which is absorbed at the solid liquid interface in such a way that the affinity of the particles for the surrounding media is increased and the interparticular forces are decreased here. Okay, for example, alcohol in tragacanth nuclease, glycerin in sodium alginate or bentonite dispersion, and polysorbate in oral and parenteral suspensions. Here the excessive usage of the wetting agent may cause a foaming or may give a bad taste or a odor to the suspension. Okay, preservatives. A suitable preservative is needed to be preserve the suspension against the bacterial growth here. The preservatives selected should be effective against a wide range of microorganisms. Example, benzoic acid, sodium benzoate, methyl parabens, propyl parabens are commonly used as the preservatives in the suspensions here. And the organoleptic additives like coloring agents, sweetening agents, flavoring agents are generally incorporated in the oral suspensions. A suitable perfumes and color is incorporated in the suspensions which are made for external use. Okay, so these are all the various types of additives used in the preparation of the suspensions. Okay, that is about the formulation of the suspensions. So that's all for today. In the next video we are going to learn about the method of dispensing the suspensions. Under that we are going to learn about the suspensions containing diffusible, indiffusible solids, precipitate forming solids and chemical reactions. So along with that the stability of the suspensions, which includes the evaluation of the stability of the suspensions. Okay, thank you for watching this video. Please subscribe to our channel for more videos.